Good afternoon. I'm Bob Proulx, CEO of Imagine Biosystems. I'm sorry I can't be at the conference today, but I appreciate the invitation from the conference organizers for us to present a little bit about Imagine Biosystems. I think everybody's familiar with the fact that magnetic nanoparticles have been used for quite some time now as an imaging agent. Their ability to affect the surrounding tissue and present T2 star negative contrast has been employed for quite some time. Typically, these agents have been used in a non-targeted fashion, that is using a dextran or sucrose kind of coated particle. And the lymphotropic uptake of the particles allows them to infiltrate, for example, the lymph nodes and present contrast. And we see here is a publication not too long ago where you see in the first series of panels the CT lymphography image of a lymph node, and then a pre-dose image and a post-dose image where you see nice negative contrast of the lymph node in panel C, which conforms to a benign lymph node, no uptake or no interference from other cells. But in the bottom panel, you can see the same kind of series where you see a CT image, the pre-dose image of the lymph node, but then no uptake in the lymph node, indicating that there were probably tumor cells associated with that lymph node. The problem with the non-specific imaging use of nanoparticles is, of course, that you can get false positive and false negative results. You're not actually confirming that, in fact, there is malignant tissue there or a metastatic tumor, but using the displacement, if you will, of the macrophages as an indication. And so we at Imagine Biosystems have been working on an alternate approach to this, where we're using magnetic nanoparticles as a targeted imaging agent. So we take 25 nanometer iron oxide cores, we tightly control the dispersity of the size of the particle and the magnetic properties, so we get good magnetic susceptibility. We then coat the nanoparticles with a polymer to protect the iron oxide core and provide a surface chemistry that allows us to then biofunctionalize the particle. We add a stealth layer with polyethylene glycol instead of dextran to help reduce the opsonization and increase the circulating half-life of the particles. And then we put a targeting ligand of some kind on there. It could be an antibody or a small molecule to get the nanoparticle to bind specifically to the target tissue. The nice thing about these particles is that they actually, through their magnetic property, can be used with two different forms of imaging. So we have a proprietary sort of hotspot imaging technology we call magnetic relaxometry, which relies on the superparamagnetic property of the particle. That is, after being exposed to a brief weak magnetic field, the superparamagnetic of the property of the particles will cause the particles to relax from their magnetized state. But particles that are not bound to target tissue relax instantly by Brownian relaxation, whereas particles that have adhered to, through the antigen interaction, for example, adhere to the target tissue, can't relax from the magnetized state as quickly, and they lose their magnetization more slowly through a mechanism known as nail relaxation. And so we can, using ultra-sensitive squid magnetometers, we're able to effectively identify within the field of view if there are any slowly relaxing particles within the field of view, and that's an indication that, in fact, the particles are bound to the target tissue. That same magnetic particle generates the same kind of T2 star contrast as the unbound, or excuse me, as the untargeted particles. And so now what we have is a dual functioning targeting imaging agent, where we can use both hotspot detection of bound particles, but also generate images through magnetic resonance of target tissue, where the particle is there generating negative contrast specifically because it's bound to the target tissue. So we've been developing these magnetic targeted particles for quite some time. The majority of our efforts have been focused on HER2 expressing tumor types. And so last year at the World Molecular Imaging Conference, we presented a poster session where we showed both the magnetic relaxometry method of measurement and the MRI using the same particle. So we know that with the type of dose that's necessary to detect by hotspot detection by magnetic relaxometry, we can get a reasonably good MR contrast at 1.5T or 3T. So we are just, with that, we're moving towards our first in-human study. And so we announced earlier this year that we would be undertaking a phase 1 study for this HER2 targeted particle, with the primary goal of identifying patient safety, of course, but a secondary endpoint for our study is to look at the initial assessment of effectiveness of these particles. So we expect to start this study actually in December. We've received HREC approval, and we're getting our study sites under contract right now, and we'll begin the study hopefully here in the month of December. This study design is one where we'll take patients who are known to be HER2 positive in the primary tumor. We'll do a background MRI, so pre-dose, then dose a single injection of the MagSense HER2 test reagent. It'll be a subcutaneous injection so that into the breast tissue for passage of the nanoparticles into the lymphatic drainage system and picked up in the lymph nodes. We'll then do a post-injection MRI. We'll do a lymph node biopsy, and we'll measure that excised tissue ex vivo by magnetic relaxometry and do the pathology assessment. So the outcome of this study, we'll get 3 different measurements. We'll have standard pathology assessment of whether or not there were tumor cells in the lymph nodes, and we'll be able to get an MRI image of the lymph nodes and a hotspot detection ex vivo for the magnetic relaxometry. If those ex vivo measurements of magnetic relaxometry conform or in good concordance with the pathology and the MRI results, then we can proceed with a full clinical study using an in vivo measure for magnetic relaxometry. But right now we're looking at just trying to get initial safety assessment of the HER2 test reagent and the initial assessment for effectiveness by these 2 measurement techniques. We look forward to being able to report the results. We expect the study will probably take between 6 and 9 months. We're only doing 15 to 20 patients with a maximum of up to 3. And we're trying to enroll at multiple sites in Australia. So ideally, we'll be able to start to report our results sometime in the first half of next year. Again, thanks for the invitation. Wish I could be there and hope you've had a great conference.